And now we want to talk about mental health and new moms. And we have our friend Shantala Boss with us again this morning. Good morning, Shantala.
Good morning, Bridget.
May 1st was Maternal Mental Health Day. And we talk about mental health a lot. These days, the awareness is much greater. And I know last time we talked about how self diagnosis is sometimes a problem, though, even with this increased awareness. But one of those components of mental health that pops up a lot of times is new moms becoming more aware of mental health and some of those challenges. Why is it that this pops up a lot around motherhood and becoming a parent?
Well, becoming a mom is a major life change. It changes everything about a person's life. It changes their relationships, it changes their activities. So it's bound to be a different time for any woman that's having a child. And I think a lot of times what we as women do is we feel guilt if we don't feel we measure up. So a lot of times women will put pressure on themselves or compare themselves to others, especially if they've been wanting to have a child for a long time and they feel this pressure that they should be elated or super excited because this has been a dream of theirs. But when they're going through all those hormone changes, whether they're pregnant or becoming a new mom, they're not going to feel the same they did before. And then they're also changing so many parts of their life. And I think sometimes what happens is new moms lose some of their identity and who they are as a person, and they get so wrapped up in becoming a new mother that they forget to take care of themselves as well. So even if they don't have a formal diagnosis of postpartum depression, I think it's normal to anticipate some changes, some different feelings, and try not to feel that guilt or shame that maybe we're not feeling what we think we should at the time, because it makes total sense that this occurs. So I think the first thing is being aware of it and accepting of ourselves as we go through those changes.
So, we talked about some of the consequences of when you're not caring for your mental health. And one of the statistics that comes up with this is that we're having a mortality rate that is closely tied to mental health conditions. And so when we look at the deaths that are occurring during and after pregnancy, the highest majority of those are related back to mental health. And that's really surprising to me because other, things like hemorrhages or infections, we talk about, a lot of times, sometimes complications in postpartum and after labor and delivery. But we're talking about deaths related to mental health being the highest cause of death related to maternal deaths.
It's really scary. And, most women don't, they may have baby blues or suffer with a change, but they won't have that high of a level of depression. So it's really important to get ahead of it. If a person is planning on getting pregnant or thinking about getting pregnant, or even just struggling with their own emotional health, it's so important that they seek help. A lot of times, women who really struggle with that intensive depression or anxiety or at risk for a high risk of death may struggle with a form of psychosis after childbirth. It's very rare, but it does occur. About 1 in 2 women will, out of 1,000, will struggle with forms of psychoses, disconnect from reality, anxiety, depression, alienation,
Mm-hmm.
loss of sense of purpose. So, any of those signs, even before pregnancy, it's really important to get ahead of that and seek help and treatment. Come up with a schedule with one spouse or partner of how to care for the child and have time for themselves,
Mm-hmm.
and really seek that support system outside. It's so, so important because you're right. It's very scary,
Mm-hmm.
these numbers that we're seeing.
And when it comes to what's happening with the body chemically, hormonally, can you touch on how there's this combination of maybe maybe there was an underlying issue before baby that maybe just wasn't dealt with, and maybe there's a predisposition to mental health issues that maybe wasn't addressed beforehand, but also how the pregnancy plays into different strains on the body that can also lead to just the imbalances that cause problems with different parts of your health, including mental health.
Well, it's so true and so important. I think we as women know when our body's changing, whether it be that time of the month or whatever we're going through. So, tracking those things, tracking those moods, those changes, and being able to connect them to what's going on during a pregnancy, talking to your OBGYN, your doctor, if you have a psychiatrist or someone you see about seeing any of those changes, whether they be mood swings, lack of sleep, irritability, and talking really about that and tracking those things is highly important because we may think we're doing fine and then go through some of these hormonal changes and it could just embellish or make worse some of those underlying things maybe that we already struggle with. And then it can feel out of control and it can get scary very quickly. So it's very important to talk to one's doctor and track those things when it comes to hormone imbalance because it's a very real thing. You're right.
Mm-hmm. And so when it comes to the medicines that people might take to help correct this, how does that play into it? Because it's, it's talk therapy that might help in dealing with things like your changing workload or some of the stresses you might feel, but sometimes medication is needed. How does that work?
Medication is very important if a person really feels like they aren't able to get past it with talk therapy and with the support systems in place. And so, talking to a person's doctor, if they are pregnant, of course, there are risk factors involved in medication, but that doesn't mean that one can't take medication. They just need to talk to their doctor and find out what's appropriate and what they can be on. And that can definitely help with hormone changes, with mood swings, and hopefully a person has kind of a background of already
Mm-hmm.
having a doctor or someone they can talk to before they get pregnant so that they can stay on top of it. I like to really push to get ahead of this
Mm-hmm.
if possible. It's not the end if you haven't gotten ahead of it, but it's so important to kind of have a baseline for mental health becoming a new mom because it's such a major life change with
Mm-hmm.
anything, whether it be a change, any change in a person's life, a move, a new marriage, a new relationship, a new job. It's one of the major stresses of life is becoming a
Mm-hmm.
new parent and having a new
Mm-hmm.
person that you're completely responsible for. It's huge. And I think sometimes with all the excitement, we forget what a big job that is and how we need to take care of ourselves.
And right, they talk about put your oxygen mask on first for moms. And how do you coach and talk new parents, new moms through a lot of the overwhelm and how to get past that maybe feeling of guilt of admitting, like, I need to talk to somebody and how do I get through this and how do I find other, safe people to talk to that won't judge me?
Well, normalizing it is so important. I think a lot of times we feel guilt when we talk about these things because sometimes with postpartum depression, women will feel a lack of connection with their child. They won't bond. They won't even have positive thoughts about their child. So there's a lot of guilt and a lot of shame because women think maybe there's something wrong with them or they're a bad mother. So knowing actually what this diagnosis is and what actually happens within a woman's brain and that it's normal sometimes to have these thoughts and feelings, but it's imperative to get help and it's okay to talk about it. So finding support, there's support systems all over that have support for women that are going through this. And I think just being open and honest with people that we can trust and finding that support is so highly important and realizing staying away from comparisons. Sometimes,
Mm-hmm.
we might look on Instagram and see that this mom's a super mom and she has every, healthy food that she's making at home
Mm-hmm.
while she has 5 kids and also works full time. And it's just not even
Mm-hmm.
true. And if it is, she probably has a host of people helping her and working with her. So looking at things in perspective is always important for all of us when we get caught up in
Mm-hmm.
comparisons or guilt or shame. And I really think that's the main thing that really brings people into this spiral. Of course, there are other things, whether they be psychologically or
Mm-hmm.
chemically, but once we start going into that guilt, that
Mm-hmm.
shame, that alienation, it really can spiral and be so unhealthy for a mom. And like you said, get on your oxygen mask first. Show your child, model for your children, seeking help, talking to people. You don't have to be perfect. We're all
Mm-hmm.
human. It's such a great role model because children will struggle as well emotionally and physically and all these things if their parents aren't well. So it's
Mm-hmm.
important we prioritize our health. It's very important.
Mm-hmm. And how can we work together to reduce the stigma around mental health and different mental health conditions? Because I think that there is still that stigma there, and people who are brave enough to come out and talk about it might be treated differently and looked at differently? How can we work on that stigma?
Well, all we can do is continue to talk about it and prioritize it, educate ourselves and educate other people, and really be a sounding board for people that are going through it. Sometimes, if we don't understand what someone's going through because we haven't gone through it, I think we may be judgmental. And that's where it can be difficult with mental health. But everybody has a different story and a different place in life that they struggle with. So, normalizing that and trying to feel empathy and support for everyone. And really, I really feel like it's getting so much better. So we
Mm-hmm.
just need to continue the trend we're doing. It's very good news that we're talking about that this morning and that you guys always prioritize talking about that. So I think we have to just continue in this, and it is
Mm-hmm.
getting better.
Yes, and it's wonderful to have you on again, Shantala, and hopefully this encourages anyone to reach out and talk to someone if they need to, or listen to a friend and help them along as well.
Absolutely.
All right, thank you, Shantala. Have a great day.
You too, Bridget.
All
Bye.
right.